Hi everyone, today we're going to talk about how to manage your catheter at home. We'll go over the different parts, how to change bags, and some important things to remember. First, we're going to go over the parts of the system. The catheter is a soft tube that drains urine from your bladder. It has a balloon at the end that is inflated after insertion to keep the catheter in the bladder. The end portion attaches to your leg with a stat lock, which is a type of sticker. The tubing connects the catheter to the drainage bag. There are two types of catheters, a two-way and a three-way catheter. The two-way catheter has two ports, a balloon port and a drainage port. The balloon is inflated by your medical provider when the catheter is inserted and keeps the catheter in the bladder. Never attach anything to the balloon port. The three-way catheter has three ports, one for the balloon, one for drainage, and one to flush the bladder while you're in the hospital. Always keep this port plugged, and similar to the two-way catheter, you will want to leave the balloon port alone. For both types of catheters, the only port you will be accessing is the drain port. You will go home with two types of drainage bags. A leg bag is a smaller bag you will wear on your leg during the day. It connects to the drain port and has a drain at the bottom to empty it. So there we're connecting to the drain port, and this is the drain at the bottom. There's a lever that controls the flow of the urine out of the bag. When the lever is in the upward position, it creates a seal that prevents urine from draining. When the lever is down, urine will flow out of the bag. You can open this and empty it straight into the toilet. There is also a cap that you can place over the drain. And then next we'll go over the overnight or bedside bag. This is a larger bag you use at night, which hangs over the side of your bed. It connects to the drain port. To empty this port, there's a drain that clips into the bag. You can unfasten it by squeezing the sides of the clip and pulling it off. There's also a metal clamp that prevents the urine from flowing. You will want to open the clamp by pressing on the flat part to open it up. This can be drained directly into the toilet. And then when you're done, it clips right back into the bag. When you go home, you will be switching your bags between night and day. So we're going to practice doing a switch right now. We're going to switch from a night bag to a day bag. So the first thing we're going to do is we're going to wash our hands. Good hand hygiene is crucial to preventing infection when you have a catheter. And then the first thing you would do is empty the current attached bag into the toilet and to drain out all of the urine. And then the next thing you would do is you would make sure that you protect your clothing by placing a towel under the connection point between the catheter and the tubing. Here we have this blue towel here. You're going to clean the connection by wiping it with an alcohol wipe and letting it air dry completely. And then to prevent leaks, you're going to pinch or clamp the catheter tubing to stop urine from flowing out. Right there. Disconnect the tubing by gently twisting and disconnecting the drainage tubing from the catheter. Use a fresh alcohol wipe to clean the end of the catheter, wiping away from the opening. Connect the new bag by attaching the drainage tubing to the drainage port on your catheter. And allow urine to flow by unpinching or unclamping the catheter tubing. Make sure the catheter and bag are securely attached and the leg bag is positioned comfortably. Use the Velcro straps to secure the leg bag. And here's the Velcro straps. These will wrap around the upper thigh. Yep, and then there's one more on the bottom. Then you also want to make sure you place a cap on the empty drainage bag and store it in a clean towel until the next use. Which we'll take this one away and we'll put that in a towel. And then once you're completed with your bag change, you want to make sure you wash your hands thoroughly. Some important things to remember. The first thing is to avoid tension. Make sure the tubing of the catheter isn't pulling. This can be uncomfortable and cause skin irritation or trauma. So one way to avoid tension is making sure that we use our stat lock device to secure it on the leg. We want to make sure we position this so that there isn't tension from where the catheter comes out of the urethra and on where it sits on your leg. Another tip is to always keep the leg bag and the bedside drainage bag below the level of your bladder. This allows gravity to help the urine to drain properly. Also, empty your leg bag when it is half full or every 3 hours, whichever comes first. Change your bedside bag before going to bed. Make sure there are no kinks or twists in your tubing. This can block the urine flow. You also want to clean your genital area and the skin around the catheter twice a day with soap and water. You can also use the catheter care wipes that may be provided to you by your discharge nurse. Next, we'll go over some reasons that you should call your doctor. It's important to contact your doctor if you experience any of the following: fever, blood in the tubing or the drainage bag, urine leaking from or around the catheter, from the tubing or the drainage bag, crystals or sediment, which look like sand inside the tubing or the drainage bag, the catheter comes out, or urine stops flowing into your drainage bag.